So yeah, it's 4:45. So hi, my name is Olivia. I'm a senior at Earlham College and I'm also a peer career coach. And thank you so much again, Hans, for being with us this afternoon. So I give you like an overview of how things are going to go. So we'll have 40 minutes together. We spend 20 minutes having an interview. So I'll be asking you questions. And after these 20 minutes, I will open it up to everybody else who has questions. So for 20 minutes as well. So, as I said, some people may be joining us on the way. So, if you see someone popping up, that's completely okay. So, my first question for you is, can you please introduce yourself and tell us a bit more about your background?
Sure. My name is Hans Kersten. I'm a pediatrician at St. Christopher's Hospital in Philadelphia. I graduated from Earlham in 1986 and worked for a number of years before deciding to go to medical school. And then have been in Philadelphia since that time.
Okay. You said you worked for a number of years. Do you remember how many years you worked before going to medical school? After
4 years. 4 years. So I worked 2 years at the University of Pennsylvania doing kind of fence research and immunology on B cells, and then I had the opportunity to go to SmithKline Beecham for 2 years, and that was a really good experience doing molecular biology. But I think it also taught me that I didn't want to be in a lab the rest of my life.
Yeah. And I was wondering, what did you do while you were at Earlham? What kind of activities, clubs were you part of at Earlham?
I was, let's see, I was played on the soccer team. I'm going to raise up my computer. I played on the soccer team, the basketball team, and I even did 1 year of tennis when I was a senior, just to kind of do it. Let's see, I was a resident counselor, which is, I forget what they call a hall convener, and then a resident counselor. And then I was dorm president my senior year.
And I also read on your biography that you majored in biology.
Yes.
So what was it to like kind of, balance between biology and like all these great activities that you were doing? Because it's also a very demanding subject from what I know.
I'm sorry, what's the question again? How did I manage all that?
So I was wondering, yeah, how did you manage biology, such a demanding subject with like all the other activities that you were, part of at Earlham?
Well, I think I was always interested in biology, and so it was just never a question. I mean, I gravitated toward that pretty easily. There's a lot of labs and a great faculty. And so to me, that's really kind of what I wanted to do. I like humanities and other things that we had to take, but I was just really interested in biology.
Yeah.
But I think part of the reason I went to Earlham was because I feel like I was really shy and just kind of developing a sense of myself, and I felt like Earlham gave me an opportunity to participate in things and to kind of grow in that way. So I think that Earlham for me was a place to kind of learn about things. It certainly taught me about the world and kind of all the different things going on in it. Certainly a very diverse place.
Mm-hmm.
Give me 1 second. Sorry. Hello? Hello? Yep, I can't talk right now. Can I call you back later? You can send it to me, okay? All right. Yep, bye. Sorry.
Fine. So I was also wondering if you could tell me more about your role as a general pediatrician, and also like I also know that you're a professor at Drexel University at the School of Medicine.
Yeah.
So College of Medicine. If you could tell us a bit about these two roles, please.
So I'm a pediatrician at a children's hospital in Philadelphia. Um, and it's kind of Philadelphia is unfortunately the poorest major city in the country. 25% of adults and 40% of children live in poverty. So there's a lot of things that affect health that are going on with the families that live here. So it's an academic kind of hospital. So it's a big tertiary care hospital that has, or quaternary care that has a NICU. It's got a trauma, it's a level 1 trauma center. It's got a burn unit. But it also has, we have a 25,000 patient outpatient practice that sits in the middle of this North Philadelphia community that is primarily Hispanic and Black or African American, but some Asian and white and other populations. So there's a lot of clinical volume around kind of all the different things that you would see in pediatrics, from asthma to diabetes to just the run-of-the-mill kind of pediatric stuff, and all these different influences of poverty and how that affects kids. But I think part of what's appealing to me is that it's, there's also 80 residents who are training to be pediatricians, and so part of what we get to do is teach. So we do get to see patients, but we also have the opportunity to teach. So if I'm in sick clinic, I will see patients, but the residents will see patients, and they're responsible for, precepting is where they'll see the patient and then present the patient to me. And then we'll kind of go over the presenting symptoms or differential diagnosis or things like that. It also gives me the opportunity to work with medical students, obviously, since it's at the Drexel University College of Medicine. There's a School of Public Health that we also work with. And then so we also have the opportunity to develop programs. So I can, see a problem, and such as food insecurity that I've worked a lot on, and think about what are the solutions to address food insecurity. So, so I feel like, it's just something that I think you learn to, it's the opportunity that I wanted, where I have the opportunity to teach and develop some research projects and get to do a lot of different things. So I feel like it is a tough balance, because, the time you see patients is what pays the bills. But to me, it's the opportunity to pursue other questions and advocacy that is also, and teaching, that's most appealing.
Okay. Thank you for sharing that. I was also wondering, were you aware when you were at Earlham that you wanted to be a pediatrician, or did it come when you went to medical school? At what time did you realize that that was your passion, that was what you wanted to do in the future?
Well, I think I mentioned that I was kind of shy and reserved. I don't think, I feel lucky to have gotten into Earlham, because I wasn't the best student, but so part of me working, so I think I always knew that I wanted to go into biology. I think because I liked science. I think I thought about being a physician. I had worked at a wilderness camp for many years, and I really enjoyed working with people and children. I'd worked at a daycare, so I knew I liked working with children. But I think part of the reason I took off is because I felt like I also needed to take some classes. So I took an international relations class at University of Pennsylvania. I took some immunology classes. I took a graduate class. And so to me, to do well in those classes, and I think also kind of gave me some confidence in my abilities, and uh, showed myself that I could do those things and that I could, go to med school. I actually had someone at Penn who told me that I would never get into medical school.
Wow.
But,
How did
there are
you
a lot
pick?
of other people who told me otherwise, but it's just, so I think part of it was me kind of making sure that that's what I wanted to do because it's a big cost, but also kind of proving to myself that I could do it.
Yeah. How do you take such terms when people tell you things like that? Because this is something that we sometimes hear and it kind of drains your energy and the motivation becomes low. But then how did you take such words from someone?
Uh, I mean, I think I internalized it and said, I'm going to prove you wrong. I think you can, I think, I've been successful, if I can say that I've been successful because I work really hard. So, that I can put in the groundwork to make, to kind of do the work to figure out what I want to do. So, or to prove that I can do that. So I think that, it just, it made me more kind of motivated to prove them wrong because I think that I realized that it's something that I want to do.
Okay. Now I have a question about medical school. What were the challenges that you faced in medical school, and how many years did you take to go to medical schools? Medical school.
Well, it's 4 years off that I took, as we talked about, and then in medical school is 4 years. So I think that I've taken off 4 years. I really grew up a lot more than I thought I had. Um, I got there and felt like, wow, I'm much more mature than I thought. But I think that it was also hard to be back in the classroom full time. Taking off kind of gave me perspective, and um, there was no question I had that this is what I wanted to do. My roommate was very smart and kind of it all came easy to him, but he wasn't really clear that that's what he wanted to do. So I think um, so the classes might have been more difficult for me, but I had no question that that's what I wanted to do. And I feel like when you started your clinical duties in the third year is when I started to excel. So that perspective and grounding, I think, kind of were really helpful at that point.
Okay. Yeah. So, just a reminder, if you just joined us, I'm having an interview with Hans right now, and in about 12 minutes, I will open it up to anyone who has questions. So, my next question for you is about your job. Once again, I'm wondering what do you enjoy the most working in your position. I would actually ask both positions because you're also a professor at Drexel. What do you enjoy the most working for these jobs?
Well, I think first of all, you got to enjoy what you're doing. So I think I really enjoy working with children. It's just I think I'm a pediatrician because you can impact them kind of early on in their life in a way that it's more difficult with adults, and kind of the trajectory you have a long impact. I also like to watch things over time. So pediatrics gave me the opportunity to do that. Um, but I also think you need to enjoy the people that you work with. And so I do a lot of stuff. I've done writing prescriptions for boxes of foods. We have a medical financial partnership. We give workshops and lectures. And so the people that you work with are, interested in that. And so I think we're all motivated and we're all mission driven. And I think that we help each other out to kind of do the things that we do. So I think you need to like the people that you work with. And then I think the other thing is that, a lot of us are here because we get to teach. So As I mentioned, there are 80 residents who are here. There are fellows and students. And so with many of the sessions that we have, we get to work with those residents and have the opportunity to teach them and learn from them as well.
Yeah.
So I think that, and then I think that the hospital that I'm at offers me the opportunity to kind of develop some innovative programs to try to see how can we help these families who are in need.
Yeah, and I think you actually touched on my next question, because you did mention about, like, families and the situation in Philadelphia. I actually spent a semester in Philadelphia last year, so I do know what you're talking about. You talked about like 25% of poverty and everything, and I was wondering, what is the biggest challenge that you face working as a pediatrician, especially in this kind of environment where there are many people who need you? What's the biggest challenge that you face?
Well, I think, another thing that I spend a lot of time, there's just so many challenges that families have. I think I come home every day kind of humbled, the stories of abuse that you hear can be really difficult to hear. That families have to take 3 or 4 or 5 buses just to get to the doctors, so we can get indignant that people aren't here on time, but when you learn about all the challenges they do just to get here, that can be very humbling. I think it's hard to see kids cry, but kids are also just brutally honest. Like I am 6'7", and they just stare at me and how tall I am, and kind of they're just gonna tell me how they feel about my height. So I think I really enjoy kind of that aspect. Kids are just honest.
Yeah. Thank you so much for sharing this. And I was wondering, how do you feel like the liberal arts education that you received at Earlham actually helped you find a career fit for you currently? How has that impacted your career journey?
I think you touched on, I think you asked about all the different experiences that I had at Earlham, and I feel like it was a lot of experiences, but I think when you are playing soccer and traveling, and you have a lab, or playing basketball and you need to get from your lab to the practice, it helps you get organized.
Mm-hmm.
So I think that those things help you get organized. I think it also gives you a different perspective of working with a team, that you have a common goals, and it's also it's a more diverse group of people than you might experience otherwise. And so I think it's something that you're working with together to have a common goal. I think that the hall convener and the resident counselor were about helping people and kind of teaching people. And I think the dorm president was about planning and, how to use your position to affect change. So I think I came out of Earlham that you wanted to listen, that there's a lot of things you can learn about, that you come up with solutions to problems, to try to tackle problems, and that you have a tolerance for diversity, and so I think that those are things that I think serve me well in what I currently do. That there are lots of problems that we see with our families, but can we step back and think about what are some interesting, novel ways to try to help these families, and what can we learn from them to sustain them and try to break this cycle of poverty. So I feel like Earlham gave me, opened my eyes to what's going on in the world around me, but I think also helped me realize that I did want to do that. And I think when I kind of proved to myself and took the MCATs eventually, that, you know, the team of physicians or professors at Earlham was there to kind of help me,
Yeah.
support me in my quest to go to medical school. You know, I at my 25th year reunion,
Mm.
it was interesting that there was a group of, I don't know if ag hall is still there, but people who enjoyed smoking marijuana were very different from the football players. You know, I was on the soccer and basketball team. There were a few of us there. There were outdoorsy people. There were just all kinds of people who had very different experiences at Earlham. But what struck me is that uh, everyone came away with whatever they did in business and education and medicine, you know, in writing, that there was, you know, a tolerance or understanding of diversity in the world. That there were, I think Earlham teaches you how to solve problems in a
Yeah.
unique sort of way, how to work with other people. I think so. I think that the experiences and the kind of lessons that I learned from Earlham, I think are reasons that I've had some success in my career.
Yeah. Wow. Thank you for sharing that. And it actually leads me like to my other question before I open it up to everybody else. You have very two demanding jobs, being a professor and also being a pediatrician. And I was wondering, how do you manage these two jobs at the same time and keep balance?
I don't. I think that's the, you know, the age-old question for all of us is how achieve work-life balance. You know,
Yeah.
as I said, I'm here because I get to do a bunch of different things.
Mhm.
Um, so, and that's kind of what I want to do. And so, I don't want to be in private practice where all I saw is patients, and I like seeing patients enough that that's not, you know, I want to have that kind of in my life, even though I want to try to help solve some of these problems.
Yeah.
So, but I think, you know, one of the ways, you know, I mentioned that I played basketball at Earlham, and one of the, to get back to the last question, one of the most fun things I get to do is actually hand a child a book. So
Mm.
I'm a pediatrician. One of the big things that 40% of children don't have books in their home, 40% of families don't read to their kids, and 40% of children are not prepared when they go to kindergarten. So Reach Out and Read is a program where pediatricians and pediatric providers give a book to a child. And so we do that from birth up until 5 years of age. And it's such a simple thing,
Yeah.
but it improves the families. So you give them a book, you can assess their development, you can talk to the parent about reading aloud to their child, and to see the child's face light up when they get a book, or to see the excitement on the parent's face is just, it's just amazing. It's such a simple thing, but they have me sign the book, they take pictures, they're just very grateful. And so it's just a really impactful, simple thing to do that I think
Yeah.
the families really appreciate. So, um, so the so what we did a couple of years ago is, in my effort to achieve life balance, is I like to play basketball, which helps me with my sanity.
Mm.
Um, and we have a program that, you know, costs us around $40,000 a year in order to raise money to give books away. And so we started a basketball tournament where, you know, I play at 6 a.m. a couple days a week, and we decided to have a tournament. Like, let's just have a tournament. And so first year we had 7 teams and raised $9,000, which was twice as much money I'd ever raised. But last year we had 14 teams and 25 sponsors and raised over $100,000. So, which is just blows my mind that we raised that much money, because it's, people love to play basketball. People love to give to a simple cause that, you know, all the money goes towards helping families that are in need. And in a way that's going to improve their vocabulary and their school readiness. So it's just, a way to do something that helps me kind of achieve my wellness, but also improves the wellness of our program.
Yeah.
So so that was a way of kind of, it's a double win for doing something that we like to do. So but it's a tough balance. You need to be able to. Some of my colleagues are much better at stopping at 5 o'clock and not looking at their stuff until the next day. But as I said, I feel like I need to work harder than other people, and kind of part of the way I do that is to find ways of, what I can do when I'm at home or after the kids go to bed or something like that. I think we all kind of have our own ways of doing that.
Thank you so much for sharing this. So now we are going to open the session to anybody who has questions. So please feel free to ask any question to Hans. Yeah.
Hi, I'm Charles. Hi, Dr. Hans, and hi to everyone. I was just listening, and I felt so humbled on listening to your story. And I'm also a senior biochemistry student, future hoping to be a future medical student as well. Although I'm not so sure if I'm actually on the path of MD or MD PhD. But one of my first question would be probably a general one, since you've been in the area of the educational and also the medical part, one of my questions would be, what is your biggest advice for people who are entering medical school in terms of, from the application side, like how do you tackle MCAT, and then once you are already in the medical school, how do you deal with the stress? Because I've always listen that it's kind of like a drinking from a fire hydrant sort of thing, and then you're probably surrounded with all the gunners and whatnot. So I don't know, like in your perspective, seeing students from the professor's side and also seeing probably as an attending physician or something, seeing medical students as well in hospitals, how do you think people should deal with this, and like any advice for future medical students?
Yeah, I think the first thing for me was to prove to myself that I could do it, and that I wanted to do it. So I think, taking classes, I got to take classes I wouldn't have taken at Earlham, got to take some graduate school classes to really prove to myself that I could do it. And I think that was a big step for me to say, you know what, I can do this. I did well in a graduate class and I can do this. So I think, and then also I volunteered. So I worked in an emergency room, and just kind of volunteering and making sure that that's what I wanted to do. So to me, although I may not have been kind of in the class as much as other people the last 4 years, I was resolute in the fact that this is what I wanted to do. So, so I think there were smarter people in my class, but they weren't as, secure in the fact that this is what they want to do. So I feel like that's a really important thing. It's very expensive these days. We haven't figured out how to make it less costly. An MD PhD is certainly a way to do that, but figuring out that you want to do it, I think, is really the key thing, because it's just a very expensive thing, and it's a long road. If you do an MD PhD, that's another 3 years that you're adding to the 4 years. So that's 7 years of kind of, and then you do a residency on top of that. So you're talking 10 to 12 years. So I think you have to, understand what you're getting into, and just do some things to help you get a sense of that. I think, like I said, I think you also got to take advantage of opportunities. When I first started, they asked me if I wanted to be the lead poisoning person for the hospital, which I didn't want to be. Well, I had never thought about it, and I was like, why, yes, I would love to do that. And so, it enabled me to become involved in the citywide efforts around lead poisoning. this is 20 years ago, and so I still do. I was on the mayor's commission to think about innovative ways this last couple of years to think how are we gonna, we started some legislation to think about ensuring that homes are certified to be lead-free. So I think, taking advantage of opportunities that helped me academically. It helped me kind of meet other people, kind of in outside of the walls of the hospital. And then I was always, I did a fellowship in academic medicine at the University of, Michigan State University. I went to the Center for Evidence-Based Medicine in Oxford. I just took advantage of other opportunities to keep kind of help me learning, and opportunities kind of presented themselves after those things happened. So the evidence-based medicine was another opportunity. More recently, it's around social determinants of health. So I think, I think kind of the way that Earlham taught you to take a problem and, try to solve some of the things, it's taking these opportunities and kind of running with them. So I think, and don't be afraid. Like, as I said earlier, someone told me I'll never go to medical school. My boss was furious with that, but you just got to figure out what you want to do and go for it. Don't let them tell you otherwise.
Thank you.
Does that answer your question?
Yeah, it did. Actually, it did. Although, it's coming from your experience, and I really appreciate that so much. Thank you so much.
You're welcome.
I have a question.
Sure.
My name is Hua, and I'm also a peer career coach at Earlham, and I'm a biology major. And thank you so much for spending time with us today. I want to ask about why you choose pediatrician as a specialty, because I know that medical school, you will have time to explore different specialties that you want to get into. And why did you make that decision to go into this field, but not other fields?
Yeah, I think it's a tough decision. You have to kind of, I think you may not have been on the call yet, but I worked with kids a lot. I worked at a wilderness camp leading backpacking and canoeing trips for a number of years. I just really enjoyed working with children. I think when I was in medical school that, I had done some research, and so I had that perspective. But I think when you do the rotations, I enjoyed psychiatry. But the patients you'd put them on medications, and 2 weeks later they'd come back when they ran out of the medications. Or if you treated adults, they'd stop the medicines when you sent them home. And so it just felt really frustrating that, I want to change behavior before they get to this point. And so I think, and I also wanted to work with an underserved or low-income population that, had a lot of other needs. So I think that as you go through it, you'll learn kind of what you wanted to do. When I was in the ER, I used to love doing spinal taps and all these different procedures to, a venous or arterial stick and things like that. But then at the end of the day, I would want to go upstairs and see how the patient was doing. So that kind of ability to follow up a patient was really important to me, more so than kind of doing lots of procedures every day. And so, so it taught me that I didn't want to do ER. When I was in medical school, I loved the general surgery, because it got to do stuff with your hands, and I thought that was really cool. But, ultimately, they kind of do the surgery and they're done, and they're, it's a different personality to me too. They're a little more, I don't know, sure of themselves, and they're just different. And that's not really the lifestyle that I wanted, because I had taken 4 years off. And so I think the experiences that I had in medical school, I think reinforced my desire to work with kids, and the experiences you have in your training help you decide kind of which fields to go into. And, but throughout my career, I've had opportunities to get further training, and I think those have only helped me in my academic career. So I think that you can only do so much before you get to med school, but you have to use the experiences you have that are provided to you to make the most of them. If I did it again, I might get a master's in public health somewhere in there, but yeah, but I think you just have to use the experiences you have to make the best decision you can.
So you were saying that if you could do it again, you would pursue a Master of Public Health?
I think so, yeah. I would definitely be a pediatrician again. I'm very fortunate to be able to do this, but I'm just saying that a lot of what I do around, addressing social needs and developing programs is in the public health realm. So I think that might be something to consider.
Yeah, indeed. So did you ever put I would say earning potential when you think about career? And what would you say about this field versus other fields in medicine?
Well, I think that pediatricians don't make as much money as other people. And when you're in academic medicine, you make less than you would than when you're in private practice. But when I was a resident, making $30,000 or $40,000 a year, I made more than my parents ever made. So, I think that, to me, it's not about making money. It's about, can I have an impact in my community and, my academic community around the country and around the world. So that to me is more important than making lots of money. Of course, I want to be able to pay back my loans, but I think you can get benefit. It's not just about the money.
Yeah.
And if you're in it just for the money, you can probably make a lot more money in other fields.
Yeah, I heard that doctors have to work a lot. So I think it's worth it. And I don't know, during this time, how hard the doctors are working, but I think people like you are working really hard.
Yeah, I think that's kind of the type of people that are attracted to medicine. And I think by and large, we work hard, and yeah, I think that's true. But, there are hard workers in all different fields. It's just, yeah.
I have a question also on a retrospective area. What do you think made you a competitive applicant when you were entering a medical school? Given that you said also you took 4 years, and obviously you obviously gathered a lot of experiences that time and whatnot. So what do you think made you a competitive applicant that time?
Well, I don't think I would have gotten in just on my performance at Earlham. I know there are a lot of people who, one of my friends had a 4.0 and he went through Earlham and went to the Mayo Clinic kind of right out. I need to take time off. So I think the fact that I, got all A's in all the other classes that I took was really important. I think that the experiences I had gave me perspective and kind of helped reassure me that I did want to go into medicine. Um, and I think coming from Earlham that there's a reputation that Earlham students know are good students and are well prepared for a career in the sciences. So I think Earlham prepared me well, and I made sure that I got my grades up, or that I proved to myself that I could do it. Because I was very involved with all these different things at Earlham. I think this just allowed me to focus a little bit more and prove to myself and others that I was able to do it. So I think it was a combination of taking time off and getting perspective, taking time off and taking some broader courses and doing very well in that, and kind of working with the team at Earlham to kind of put that all together.
Thank you.
Thank you very much for all these answers to the questions. So we are running out of time, and I was wondering, Dr. Hans, is it okay if they reach out to you through LinkedIn if they have other questions, since we don't have enough time left?
Absolutely.
Thank you.
Glad to answer any questions.
Yeah. So please, guys, feel free to reach out if you have any more questions. So I just wanted to say thank you very much for taking some of your precious time to talk to us today. I know you're very busy, especially with this situation. So we truly appreciate it. Thank you. It was such a delight to listen to you and to really see how having an impact is so important to you, even after Earlham. So thank you very much for joining us this afternoon.
You're very welcome. Good luck to all you guys, and hopefully I'll see you on campus sometime. I guess you guys are seniors, right? So
We are.
What are you doing next year?
I'm working for an OPT, so I'll be working as a research associate first for a year or two before. I'm actually using that 2 years as well, as of a 2-year gap, for me to contemplate if MD is for me or MD PhD, or either neither of them are for me. So I'll be working for research associate first, then get through from that to go.
Good for you. How about you?
Yeah. Oh, okay. So I'm a global management major. So I'm applying to schools currently. I want to go to grad school directly to do public policy or an MBA. So
great.
I thought about medical school before I got to college, but I was not good enough, so I decided to do a PhD. Never mind. That was just I think my way of learning is better suited toward doing research. So I applied to a PhD program in biology, and I got accepted to a PhD program in University of Spain in biomedical science. So
great.
I will be there, but with the situations going on, it's unclear whether I will be able to get a campus that time. Yeah, that's definitely.
Well, that's great. Congratulations.
Yeah.
thank you so much. Have a great rest of your day.
You're welcome. Do I need to look at these chat questions, or that's oh, no?
I think there were previous ones. No, that's fine. Yeah, I think we answered them all.
Great.
Yeah. Charles, sorry, I cut you off.
Oh, no. I just said thank you so much for your time and for sharing your time and day for us and all your wisdom as well. Thank you so much, Doctor.
You're welcome. You guys take care. Be safe.
Take care. God bless. Bye.
Bye-bye.